health and social welfare, and we look forward to an enriching exchange of ideas and insights. Today's event will be divided into two sessions. The first session will be on the launching event.
Implementing agency for the Social Protection Help Desk project. I would like to welcome each and every one of you to this launch program. A very special welcome to our funding partner from Tata Aig'S, Mr. Devang, the Deputy Vice President and Lead CSR in Ethics. Thank you, sir, for coming all the way and gracing this launch program. Our partner team from Swasti, led by Mr. P. Bhupati, the National Social Protection Lead, and his colleagues, Ms. Bhavna and Kajal. Thank you so much. We are also honored by the presence of our Nagaland state officials from the Directorate of Health and Family Welfare, Government of Nagaland. Our chief guest for the day, Dr. E. Motsukam Patton, the Principal Director. Welcome, sir. And Dr. K. Kamaran Longkumar, Joint CEO, Nagaland Health Protection Society, and his esteemed colleagues. Thank you, sir, for being here. I welcome you in the name of the organization and also all our funding partners and stakeholders. I also welcome the media team who, as always, are always there to come and participate in the programs. Thank you so much. Having worked in the development sector in the northeastern region for the last 24 years, we at TEA, or the Entrepreneurs Associates, we are very acutely aware that our farmers, the women that we work with, entrepreneurs, street vendors, the poor, can become truly empowered when they have access to health and insurance coverage, which is a pivotal part of their empowerment. We feel that health remains at the core of well-being for every individual, whether the poor or the rich. We are therefore very happy to launch this program with our funders and stakeholders to make health schemes and programs more accessible as we take up this project in Peg and Zuniboto district with the hope that it will be expanded to other districts in the years to come. We also have been working with health practitioners for our various livelihood programs, but this is one of the first of its kind for us also, and we are extremely hopeful of the impact that it will create in our local ecosystem. Sir, your visionary leader. Sir, your
Tata Group was founded in the year 1868, more than 55 years ago. The founder was Jamsetji Tata. We all read about him in textbooks in our school. He's known as the father of Indian industry. He had a vision of nation building, and it was at a time when he founded the group when India still didn't have political freedom. He was still under the British rule. At that time, he had a vision, one day India will have political freedom, but equally important is economic freedom for the country and for its citizens. So he chose the path of industrialization, that is setting up factories and offices, which will serve several objectives. It will add to the GDP of the country. It will generate taxes for the government, which it can use to fund the welfare schemes for the poor. It will generate employment. It will also generate surplus in terms of profits. So what do you do with those profits? Typically a company is formed to generate profits. So a very pioneering concept then, wherein Tata Sons, which is the principal parent investment holding company of the Tata Group, 2/3 equity of that Tata Sons, which is 66% of equity of Tata Sons, is held by philanthropic trusts. They are known as Tata Trusts. So today as we speak, over several decades, every year they have been investing in health, education, livelihoods, art, culture, across the length and breadth of the country. And please note, there was no law mandating them to do so. It just came from within that this is our country and we need to serve our communities. So improving the quality of life of the communities through long-term stakeholder value creation and keeping leadership with trust at the core has been the mission with which the Tata Group has been functioning. So today the Tata Group has kind of 30 big companies. We are present in 100 countries. We are a global enterprise. As on last year, our market capitalization was $165 billion. About 27 of them are listed companies, about $365 billion. It creates direct employment for about 1 million people across the world, which is about 10 lakh people. And it is known as a salt to software conglomerate. Under the financial services sector is a company by the name Tata Aig'S General Insurance. As is with TEA, which is a 24-year young organization, same is for us. We are a 24-year young organization. It's a joint venture between the American International Group, Aig'S, and the Tata Sons. We are present in about 230 locations or offices across the country. We are more than 8,300 employees. We are largely two lines of business. One is consumer insurance, the other being commercial insurance. We have about 8,300 employees offering these different insurance products across the country. We are among the leading private sector general insurance companies. As far as CSR is concerned, or the corporate social responsibility, the company has 5 themes as they are articulated in our CSR policy. These include healthcare, which is the subject of our focus today, the others being education, integrated rural development, disaster response, and environmental sustainability. Over the past 4 years or more, there has been a strategic focus on Northeast for Tata Aig'S, because the company believes that the hitherto underserved areas of the country may be remote and for several reasons they wouldn't have been able to realize their true potential. With whatever limited CSR resources we have, can we go and serve these communities? With that intent, during the COVID time is when we started our first steps in the Northeast.
Group of like Tata company, we have a Catalyst group which comes under Susti, is one of the health initiatives run as an NGO, cut across working in Pan India. And we have a Catalyst Management Service, is a profit-based organization working on consultant, especially on monitoring and evaluation. And we have Vritti as another collaboration partner, focusing on farmers, especially working in southern part and northern part of India. And we have Physio, it's a marketing firm working closely with the organic food and also with the farmers. And we have a Green Foundation working on climate and biodiversity. And we have a Catalyst Foundation making us an enterprise model with all the partners. And we have a Impact Catalyst Foundation where we have registered an office in US and working with other countries, especially Southeast Asia and also with African countries. And recently we have started Upfront, focusing only with the informal workers, where we have been having working with different brands like Levi's, Walmart, BSR. So almost covering India, Nepal, Bangladesh, and Sri Lanka. So how we started the partnership with Tata Aig'S last year, we went in, started the program as a pilot in Uttar Pradesh and Assam, as mentioned earlier by Devangji. And this is the pilot project and focusing on health insurance schemes which was provided by the government.
Initially, we thought that we'll work in the aspirational district, which is Zunegoto, and in the block Aig'S. So, but later on, we had discussion with government partners, and they suggested that we can even move to Fek district, so as more people could be covered and the coverage could be extended to that district as well. For this phase, to 24-25, we'll be implementing the project across these 2 districts, and 2 blocks we have selected. So, but the work is not limited to these 2 blocks only. So, if we feel that more communities and more people need these kind of services, then we have told TA that they can extend to the nearby areas also, like nearby blocks also, wherever they will feel, the field team will feel that the need is there. Services which are given by the government. So, I think most of us here knows what are the difficulties that a common person has, while he or she want to go and access a particular scheme. The government is ready, because we have worked with the government last year also, and based on our experiences in field, we know that government is readily, offering that people should come and take these services. But there are certain gaps, which may be due to lack of awareness, lack of those facilities, lack of the access of the general public As I mentioned, the objective is to improve the access to healthcare. So, primarily there will be two objectives we'll be focusing on during this phase. One would be creating awareness. So we will go to the communities, we'll tell people that these are the schemes which are available from the government end. Then we'll work with the communities, aware them, and whosoever is willing to apply for these schemes, the teams will do the facilitation for those people. And the other objective includes enhancing the access. So when people will understand that the scheme is beneficial for them, then definitely they'll come out and they'll be willing to apply for those schemes. So based on that, we are hoping that we'll improve the access also within the communities in Fake District as well as Zune Bhoto.
We all know that poverty affects both the quality and length of people's lives, leading to reduced productivity due to poor health, lack of education, and limited economic opportunities. In the absence of social protection, people, especially the most vulnerable, are subjected to increased risks of sinking below the poverty line or remaining trapped in poverty for generations. Now, therefore, with the aim to reduce the lifelong consequences of poverty, deprivation and exclusion, government has initiated various social security schemes to provide decent work, education, healthcare, food security, income security, etc. Then in Nagaland, several social security schemes are being implemented, such as Prime Minister Jan Arogya Yojana and PM Jivan Jyoti Bima Yojana, PM Suraksha Bima Yojana, the Shashan Card, Mid-Day Meals, etc. And however, people, particularly the vulnerable and weaker sections of the society, are unable to access the benefit, mostly due to lack of awareness. So in this case, we need to give more awareness to the people, particularly the vulnerable groups. I'm very happy to know that Tata AIG General Insurance Company Limited, under its CSR initiative, is supporting promotion of social protection interventions.
The state government introduced a Chief Minister Health Insurance Scheme to extend the health insurance coverage to all the citizens of the state in 2022. So now, Nagaland, because of this intervention, Nagaland is a universal health coverage state. And thank the government for taking this bold step despite its limited resources. Having said that, I just jumped to, in the interest of the time, I jumped to the issue today here, the intervention that we are going to launch. We have, out of this, entire population is being covered. As of now, we have covered about 90% of the household with at least one e-card. Okay, about 90% out of the 4 lakhs households. However, each individual should have one card, isn't it? Because we are covering the entire citizen, not as per the household. One house, unlike the ration card, one ration card per household. But in the health insurance, it is one card per citizen. So therefore, the individual card that is issued is only about 7 lakhs. That means out of 20 lakhs population, only 7 lakhs is covered. That means around 13 lakhs is yet to be to get the cards for whatever reason. One reason is the lack of awareness. Right? And why we have selected this 2 blocks is that if we look at our team will be showing you in detail later in the later part of the program. If we see Zune Bhoto is one of the lowest in terms of card penetration. So also okay. The Aig'S district like Dimapur or some other district where there is high penetration of card. The reason being obvious, card. Also, the effect, the impact of the literacy is also there. We cannot deny that. So all these factors are there, which is preventing the access to the schemes. So when we go out, my suggestion to the team, to the district team, and which will be implementing, is to involve also not only in the awareness creation. Awareness creation means you will call the people and give a talk on this. In addition to that particular service, involved in the card generation. Okay, your team may be having IT tools like a computer, or you may even give them also laptop by a fingerprint reader. Only these two are required. The remaining ones, the card is KYC is collected. Then the card can be a digital card, which can be shared through WhatsApp. Later on, if they need, they can print out. But even the digital card is sufficient, right? So involved in the card generation.